If someone were to have a reaction to lidocaine while you're doing it,
We stop injections
you
right
stop.
away.
Okay, yeah, and you would see it right away.
Oh, you would see it right away.
Okay.
Yeah. And that's the same thing. So the highest risk for, one at a time. We're like
One
getting
at a time.
distracted. We're getting so excited
I
about
know.
everything. So hyaluronic acid, discomfort, redness, swelling, bruising.
Yes.
Right? It's an acid. It burns
Yes.
going in. So it is going to be more painful. The most complicated side effect of hyaluronic acid is actually a vascular occlusion or an arterial occlusion.
Oh, God.
Because hyaluronic acid filler, we get really into like the science of it and like the G prime and how viscous it is. There's different viscosities of each of these products. So you actually have to choose the right product for the different areas of your face.
Wow.
It's not one product fits all.
Okay.
Right?
Yeah.
So you have thinner products and then you have higher, thicker products, which are more like the deep bone injections where you're trying to re-anchor tissue. And then the nice softer ones where it's higher up in your
More
tissue.
superficial?
More superficial, exactly.
Okay.
Like your because you can have deeper injections for your nasolabial folds, but you can also have up like surface level injections for your marionettes, for your nasolabial folds. So you have to choose the right product. Right? Choosing the right product is very important. However, because your face is so highly vascularized, you can block off a vein or an artery. It sounds super scary. My favorite is when I explain this to people and who've had treatments before and have never been told these things.
They're like, what?
Yeah. That's okay. I'm explaining it now.
Yeah.
But that is, as an injector, you can recognize that right away.
Okay.
The area immediately blanches, right? It's kind of like when you go to like press down on your hand
Yeah.
and it goes white.
It goes white,
And then
yeah.
it goes pink again within like 2 or 3 seconds.
Yes.
That's a cap refill. That's your like skin turgor. That means that you have proper circulation
Yes,
when it
yeah.
goes back to normal. Obviously, if you're like always freezing cold hands,
Yeah,
that's
right.
going to be a little bit slower. So don't be alarmed if you're like, oh my God, I have 5 seconds, I have circulatory issues. You're cold. Coldness will decrease your circulation as well. But you recognize that right away.
Wow.
So when the area blanches, you stop injections.
You wait.
You pull back on the needle. You aspirate a little bit. Usually you can't actually aspirate the product.
Yeah.
But the first point is sometimes you don't have to stop the treatment.
Okay.
Sometimes you just massage it out.
Ah, okay.
Massage is the first thing you do.
Okay.
Well, after you stop.
After you stopped.
After you stop and try to pull back any product, then you're massaging the area.
Okay.
And there are times where you do get blanching because, especially with lips, if you get a little bit of blanching, it's a little tubular cavity, right? It's a small space that you're working with. And that's why that's something you want to build. Some people have smaller spaces
Of
there.
course, yeah.
So even when you start injecting just a little bit, sometimes you'll get blanching.
Oh, wow.
Yeah.
And you see it right away.
You see it right away. But then you'll get that blanching, and then without you even, you just stop the injection, without you even pulling back the needle, sometimes you'll immediately start getting blood flow again.
Oh, okay.
And that's just because, maybe you're just right above a vessel.
Right.
And when you added the product, it compressed on the vessel. Right?
Makes sense.
And
yeah.
so it's figuring that out, right?
Right.
And that's actually looking and feeling.
Yep.
Whereas if you get the blanching and it doesn't go away right away, the first thing you're doing is you're pulling out the needle and then you're massaging the area.
Okay.
You massage the area,
It's fine. It's
and then and you get blood flow return, then you
Okay.
continue. You can continue.
okay.
If you don't, you always have to have hyaluronidase, which
Oh.
is the antidote.
Okay.
You should not ever be getting hyaluronic acid treatment without hyaluronidase present.
Okay.
You always want to have, or Hyalase is the like brand
That's
name.
the name?
Yeah. You always want Hyalase present because if you inject in high volumes, like let's say you have a clinic and you see like you inject Monday to Friday, you see 8 to 10 clients a day. When you have high turnover like that, if you're a good injector, it is impossible for you to not have vascular inclusion.
Right.
I can't, because you have a percentage of people who have vasculature that's higher up to the upper layers of the tissue versus deeper.
Right. Yeah.
So it happens.
Happens.
The best injectors will have vascular occlusions.
Okay.
But they also know how to handle those side effects, those adverse effects.
Okay.
You stop injection right away and you're immediately dissolving that area.
Ah, gotcha. Okay. That's
that's
the
it.
product that just takes it away.
It takes it away.
Okay.
And that works immediately. And then when that does happen, unfortunately, you're not getting injections again for 2 weeks.
Right. Yeah.
So you kind of like start over.
You start over. Yeah.
But that's the risk that people need to understand. And that's the highest risk complication.
Okay. And the percentage of that, I guess it depends on the person.
It depends on the person.
Okay,
I think
yeah.
I've had I think I thought I had one, and it didn't actually end up being one.
Oh, okay.
Yeah, and I
Okay.
have I think I have about 200 clients now.
Yeah.
And so, but I don't have the same volume as a lot of people do, right?
Right.
Because I still work 3 jobs.
You're crazy.
I do 3 part-time jobs. But the best injectors, if you haven't had a vascular occlusion, you're not injecting in high enough volumes.
Right. Okay.
Right.
Yeah. Yeah.
But it's understanding how to manage those complications.
That's-
so it's
yeah.
very important.
Yeah.
Other complications that are more like little side effects that can happen, unwanted ones especially, there's going to be some asymmetry.
Yeah, for sure.
Right?
Yeah.
Because our faces aren't symmetrical.
No.
I mean, some people aim to get symmetrical faces with these injectable treatments.
Right.
But it's kind of like your eyebrows. They're not twins, they're sisters.
Exactly,
Right? It's
yes.
the same thing.
Same thing.
There's always a risk of asymmetry, especially at the point of injection. Like, based on what I'm seeing is like, oh, yes, I'm aiming for symmetry, especially with lips, for example.
Right, yeah.
I'm aiming for symmetry. But depending on, like, if you already have an asymmetrical lip and I'm adding more to the other lip, to like the other side to try
Right.
to make it even, I'm going to have to wait for all that swelling to come down.
That's it. Yeah.
To see if you're actually going to be symmetrical in the end. Right?
Yeah.
Because there's going to be a lot of swelling and bruising, especially with lips. Yeah. Cheeks, not so much. I mean, you still do get the bruise. Sometimes the jaws, yes. But lips specifically, because it's like the most popular treatment nowadays is getting your lips done.
Yeah. True.
So there's going to be a lot of bruising. In the other areas, in terms of like, I find nasolabial folds, I have had small nodule formation, which is
Oh, really?
also very normal.
Okay. Yeah.
That should go away within 2 weeks to 1 month.
Okay.
Your body just reabsorbs it
Yeah.
on its own. And it kind of looks like a little whitehead.
Yeah.
You
Yeah.
want to like go to pop it, but you don't.
But there's nothing
But
like you
that's
can't.
just, you can't. It's just there. It's a normal autoimmune response.
Yeah.
Your body is literally going, there is something foreign coming into my body.
Yeah.
I'm going to encapsulate it.
Mm.
And that's
so
where you
on
get
top
the-
of the filler.
Yes. It's
Okay.
encapsulating that little bit of filler and has caused a nodule.
Oh, that sucks.
And that's just your body. And
Yeah.
that's why it'll take anywhere from 2 weeks to 1 month for your body to reabsorb that encapsulated space that it's decided to be like, foreign object, alert, alert.
Alert! Alert! Yeah. That's so interesting.
Yeah, and
Wow.
it's just like understanding actually like anatomy, physiology,
Right.
like your body's immune response to these things. 'Cause
strong.
they're all foreign substances, right? That's all it is, right?
So your body's gonna respond.
And your body's going to respond to these foreign
Yeah.
substances.
yeah.
But yes, vascular occlusion, what else? Oh, and then the main ones are going to be very similar to neuromodulators.
Okay, yeah.
Yeah. Oh, I did forget to mention for neuromodulators, sometimes you can get, with upper forehead injections, transient headaches.
Oh, yes,
or
the headaches.
transient numbness.
Okay,
The
yeah.
nice thing about that is sometimes with one brand of product, if you get the headache, the next time you see me, we can try to switch the brand
And see.
and if you don't get that side effect with it. Sometimes it's brand.
So yeah.
Yeah, exactly.
You just try it out.
Exactly. You kind of just try it out, and when
Okay.
you're getting it done the first time, it's like medical art, right?
It is. It really is.
It's medicine, but it's still art. So it's fine tuning.
What works for you.
Everyone's faces are different.
Yeah.
It's what's going to work for you.
Yeah.
In terms of post care now for
Yeah.
hyaluronic acid, these substances are actually quite movable for about 72 hours.
Okay.
I'm extra careful. Most places tell you like 48 hours, just don't heavily manipulate those areas and try to sleep on your back.
Yeah.
The most important part is sleeping on your back.
Right.
I'm like extra careful. I'm like, just 3 days, try to sleep on your back,
Yeah.
please.
Yeah.
And that's just for anywhere. Like if you're a side sleeper, if we're doing cheek fillers, just sleeping on your face can push that filler
That's true.
to a different area. I do a lot of massaging in the end so that you're not feeling the lumpy bumpies, right? But if you're going to sleep on your face for 8 hours, that's
gonna
8
move.
hours. That's 8 hours of gravity and your face and the pillow just pushing everything away.
Oh wow.
Other little things that aren't necessarily mentioned, like drinking through a bottle if you're doing
Right.
if you're doing lip filler.
Yeah.
So some people, like if they drink through just like the disposable water bottles,
Yeah, the water-
like
yeah,
the tiny
The tiny hole, yeah.
and they like to like suck back the water. You can leave an indent in that.
No way.
Yeah.
Oh wow.
you
Okay.
can.
I never thought of that one.
Yeah. And so you really just want to not manipulate those areas
Yeah.
for at least 72 hours because it's still highly movable.
Yeah.
And then sleeping on your back.
Wow.
24 hours, you're still not doing any like excessive hot. With all the swelling that you get to the areas, you can apply like a cold compress.
Right. Yeah.
Yeah.
No
Especially,
ice though.
I wouldn't do ice. I would do cold compresses. And I find with the ice, anyways, you're always putting a barrier between skin and ice.
And ice. Yes.
Yeah. I usually provide like a little cold compress, anyways.
Right.
But you know how the gel packs don't actually get frozen?
Yes. Yeah.
Not those like freezer packs that you take on vacation with you. It's those movable
The jelly
the
ones.
gel ones. They don't actually get frozen.
They don't,
They just
no.
get cold. So those ones are
They're
the ones
good.
that you want to use.
Okay.
For any swelling that you're getting. And then you're also, you're just not applying any makeup to any of the sites for about 6 hours because we just want the pinpoint pricks to heal over, just decreasing your chances of infection. Just because your body, like your skin's your first line of defense for all infection.
For sure.
So that's also a risk for any injectable that you're getting. There's always a small risk of infection because we're breaking your skin.
True.
Yes.
Yeah.
The other thing for both of these is obviously you don't want to be on antibiotics. Any vaccinations that you've been getting, this is actually quite new.
Yes.
This one's new since COVID.
Yeah.
They found that some people who got lip injections were getting, if they got their vaccine, even like a month later. If they were getting a vaccination, they were like, why are my lips swollen all of a sudden?
More reactive?
It was more like there's very little research right now because it was so new.
Because it's new, yeah.
But just based on like my critical thinking skills, like it's an inflammatory response.
Right.
You got a new immunization.
You got a disease.
Yes, exactly. And your body is having this immune response of inflammation.
True.
And where else do you have foreign substances in your body? If you had lips done, or your filler, your fillers are going to be foreign substances.
That's true,
right? It didn't happen really with any of the neuromodulators, because that's already taking effect within 2 weeks.
True,
right?
Yeah.
It's not like sitting in your body for 18 to 24 months.
For a long time, yeah.
Yeah. So they found that some people were getting this like rebound swelling when they were getting immunizations.
Wow.
So now if you have immunizations anywhere, like within the week, we always ask that you are 2 weeks, post immunization before you come to see us, and wait 2 weeks after to get immunized for any type of immunization.
That makes sense. Yeah, it's a lot on your immune system.
It's a lot. And then the other thing is, if you suffer from herpes simplex, so like cold sores, sometimes you can get a reactivation of the herpes simplex virus for cold sores. And if you are, I've had people who do get cold sores, they never get the reactivation.
Oh, okay.
And I haven't had any yet, but again, I only have like 200 clients. I know it sounds like a lot, but it's not that much if you inject in high volumes. Like the cosmetic surgeon that I work for has like 30,000 clients. So.
Okay, well, to be fair, he's been in it way longer than you, so.
Yes, but if that does occur, we just give you prophylactic antivirals.
Okay, so there's always a solution.
Exactly.
There's always a solution.
There is always a solution.
So that's good.
That is the good thing about hyaluronic acid too. If you hate it,
we
dissolve it.
That's true.
We dissolve it.
Yeah.
It's at least you can like dissolve it, and then like 2 weeks later, your face will kind of look the same.
Go back to what you had.
Exactly.
Yeah.
Whereas with neuromodulators, it's like, in 3 to 4 months, your face will go back. Not necessarily all the way back to the same, because remember, we decrease the contractility.
Yes.
So I say about 6 to 8 months before you're at that full muscle capacity again.
Okay. So for the people, we talked about this the other day, but like the people that have like a strong frown and they actually have like a bump, because their frown is so strong. You were talking about the way you were saying it was like music. I was like, keep talking, please. That the neuromodulator is actually going to flatten that muscle because it gets weaker.
Yes.
So, that's what it is.
Yeah,
okay.
That's exactly it. That's the muscle. That's muscle atrophy.
Okay.
That is exactly it.
Okay, so for anyone that has like a bump.
Yeah, especially that eyebrow one.
Here.
Some people have that corrugator muscle is really strong. Some people have this little bump. And then what happens when I go to tox it, for some reason, some people notice it a little bit more. Like they didn't notice it before.
Oh.
Until I tox it, and they're like, "Why is there a bump here now?" I'm like, "Your bump's actually smaller."
Okay.
But it was one of those things where they weren't hyper aware of it because what happened is now they're not able to contract it as much. So that bump was less noticeable when they were able to frown.
Gotcha.
Because they were able to,
because
all they could see was the line.
The line, yeah.
But now that you can't create the line and that's flattened out, now all you notice is the bump of the muscle.
There you go.
So over time, that will atrophy.
Okay.
You know, when you like frown and you have all your skin bunch up, then you're not going to be able to see that that prominent bump of that muscle until you're not able to bunch up all that skin anymore. And you're like, what is that bump? I'm like, that's actually the muscle I
That's the muscle. Yeah. That's so crazy how you can like modify that. It's great. So for someone that has a really high metabolism, I know Botox neuromodulators, they're going to last less because your body's that's just how it is. But what about fillers?
It's the same thing.
It's the same thing? Okay.
Yeah. It all depends on people's like metabolism, right?
Yeah.
And that's why, luckily, during the consent process, I can't say how effective these drugs are going to be for you.
No.
It's kind of like, and that's the same thing with like when you do Dysport or Botox or Xeomin. I don't know how effective any of these drugs are going to be for you. They might be all botulinum toxin A, but one's acetaminophen Life brand, one's Tylenol brand acetaminophen.
Okay.
And that, you know what I mean? And like they're all Tylenol, they're all acetaminophen.
Yes.
But they're all different brands, and those different brands are formulated and made differently.
Right.
The preservatives are made differently. The pills look different.
True.
And that's why some people are like, Life brand Tylenol doesn't work for me. Regular Tylenol only works for me. Right?
You will know.
Yeah. And the thing is, we don't know how effective it's going to be until we try it.
Until you try it. Sometimes it's trial and error.
Exactly. And that's why I always start with the one that's a little bit more affordable for most people.
Yeah.
And that one, if we end up like lasting the 3 to 4 months, then we stick with it.
Great.
If you get a headache with that one, we switch to the other brand. And then if that one only lasts 2 months and you're like, oh my God, this one only lasts 2 months. Okay, then we'll switch back to the other one.
I'll get the headache.
Yeah, exactly. You kind of weigh out the pros and the cons of either of them.
Okay.
But my goal is to hopefully have these drugs last you anywhere from 3 to 4 months when they're neuromodulators. And then with the current brand of product that I use for hyaluronic acid is anywhere from 18 to 24 months. I haven't had an issue with my hyaluronic acid yet. In terms of the metabolism and like having it last 18 to 24 months.
Yep.
And I feel like maybe they have done that research in terms of like, that is the 18 months is for the people with the high metabolism.
Oh, okay. So
I wonder if that's what it is. And that's why I haven't had a problem because I explained that.
That would be great because 18 months is still pretty long.
Oh my God, yeah. It's quite long.
It's quite long.
You start to metabolize it. You could also get migration though, right? Like
true. It can move.
A lot of these products migrate and there's a lot more like MRI, CT scan research going into filler migration.
Okay.
Whereas you think your body's actually completely dissolved all of these products.
But it's moving.
But it's actually moved. Some of them, it's like closer to your sinus cavities. There was like one specific video I watched and I'm like, I knew it. I knew it.
That's so interesting.
Yes.
So instead of actually eating it.
Yeah, like metabolizing and having your body get rid of it, it's actually just migrated further into your face where you can't see it. Yeah. And like with lip filler, when you start getting migration, you could see it. It's like right above your upper lip. And it's like kind of like
here.
Yeah, like in your like in between your philtrum area, like all that area there. You can see it. But some of these like deeper injectable sites, it just migrates to like, you know, like around your sinus cavity, somewhere else where it's deeper, where it doesn't actually cause a cosmetic effect for you.
I was going to say, is it going to make you look weirder?
It doesn't make you look weirder, but it's a little bit concerning to be like, oh my God, this is still in my body somewhere.
Yeah.
So it's really cool to see all that like updated research right now of how the filler doesn't actually get completely metabolized. And these are people who are like 5 years down the road. Where it's like, well, these fillers only last 18 to 24 months. Why do I still have filler like over here in my sinus cavity area now?
Interesting.
Yeah, it's super cool.
It's really cool how there's always continuous studies on that. Last question, because we're talking a lot. Oh, wait. Are we over time? Hold on. What time is it?
We're just having so much fun.
Okay, it's fine. We've got 10 minutes left.
Okay, perfect.
I think I'm going to do a 2-part series with this one.
I love it.
So, what would be your tips for someone that's thinking of doing Botox or fillers, neuromodulators? What would be like your advice? They have no idea what it is. They want to get into it. What would be the reasons or like the right things to look at before getting into injectables?
I think for me, I always actually recommend neuromodulators for a lot of people. It's so safe because you're not augmenting your face. I find that all you're doing is decreasing the contractility of a muscle.
Right.
If you look in the mirror and you go, oh my God, that line really bothers me. Or let's say you have, and we have 2 types of lines. We have dynamic lines, which is when you move your face.
Okay.
The lines that you create when you move your face, those are dynamic lines.
Right.
So in younger individuals, we are now currently treating dynamic lines, right?
Right.
Because if you treat the dynamic lines, then you're not going to have static lines, which are those lines that are at
They're
rest.
staying.
They're
Yeah.
staying. So that's what the prevention treatment is all about, right? Some people wait until they have just that little tiny line, the one that you can barely see. You got to get the right angle of the light to see the line. If that bothers them, come get a consult. We discuss all these things. I've talked about it here.
Yeah.
But some people don't know, right? They're like, this line bothers me. And it's like, okay, well, we'll do a consult for your whole upper face.
Yes.
But it's one of those things where hearing it in person.
Yeah, makes
a lot
difference.
better because everything I'm telling you, I'm sure you can find
can
online
research,
on
but
the internet, right?
Yeah.
But it's also like you actually have to vibe with your injector.
So true. It's like us. Same with us. It's the same thing.
And that's the thing. Like
Yeah.
I feel like this is something that you definitely want to get a consult with. Like, and it can just be a simple nurse consult with me.
Yeah.
You're seeing me. We're discussing things. We're seeing if we vibe with one another.
Yes.
It's as simple as, and then it's so much like for a person to feel more comfortable, you have to meet them.
That's true.
Right? You have to meet them and feel like, okay, I trust this person with my face.
With noodles.
But I say, take note of what facial expressions you're making all the time.
Good. Okay.
The one thing is some people don't realize that they're doing that. They're like, oh, well, it never bothered me before, so I don't really know. And sometimes I like, if I'm doing a consultation with them, maybe a week later or 2 weeks later, they're coming to see me. And I'm like, this is your homework. Let's take note of what facial expressions you're making all the time without you being aware of it. And that's the homework I gave myself before I started my treatment journey as well. I used to pour meds. I would pour meds with my face in my RBF, my RBF, and I would be like, oh my god,
you can say it, your resting bitch face.
My resting bitch face. I would literally pour meds with my resting bitch face, and I would start tapping myself. I'm like,
stop.
You're not even concentrating on anything. You're confirming that you're getting the right drug and you're dispensing the right drug. So that was me. I would think with a resting bitch face.
Yeah.
If I was thinking too hard, I'd be like, oh my God,
what's
stop.
going? Stop.
And I didn't even have a line yet. But it was one of those things where like every 2 seconds I had a resting bitch face. And I was like, what is going on? And so that's why I toxed it.
Yeah. Yeah. And it's a good reason.
Nobody notices that I get treatment. Absolutely nobody.
But that's the beauty of having a good inject. Well, I think you do it on yourself though, right?
No.
Okay.
No. Good injectors will not inject themselves.
I mean, but
I did it once at the height of COVID,
tried.
and it was the most awkward thing, and I would never do it again.
Yeah, no, that's hard. But that's what I tell people. I'm like, listen, if you can't tell that someone's got injections, fillers, whatever, they just look, hey, like, what did you do? That's the secret. That's because you have a good injector.
And that's what the goal of treatment is for all of my clients.
Of course.
It's like the biggest compliment I have when people are asking me what I did and I just told them I changed my skincare. I'm like, fantastic. That's what I love to hear. And these aren't just neuromodulator clients. These are clients that I fill.
Oh, yeah.
That I give filler to. Like I actually inject them with augmenting products.
That's crazy.
Products that are supposed to change the way their face looks.
Oh, wow.
Yeah.
But that's the best compliment. Yeah.
So if you're thinking about it, your homework is for neuromodulators, think about contractility of your face, what facial expressions you're making all the time.
Yep.
Because the dynamic line treatment is where to go at first, right? In terms of if you're looking to augment your face, I think you really need to, it's like super deep work that you have to do with yourself. At what point will you stop for your augmentation, right? This is like
we're getting into like mental health
exactly,
there. Yeah.
And I think that's an important discussion that people need to recognize and have nowadays. Is that there's only so much that I can augment your face, that you can augment your face until you're satisfied with, until you reach the point where there's no going back.
Oh my God,
where you've augmented your face too much, where it's like, okay, so have that discussion with yourself, have those self-reflection periods of, is it my body dysmorphia?
Right.
Right? And I'm not afraid to have those conversations with people. I work in acute care.
Way worse.
I have had these conversations with people where I'm like, your lips are a perfect size right now. We are topping it up, but I don't recommend that you go any bigger than this.
There you go.
And I'm like, everyone's got a bit of just body dysmorphia. Maybe the discussion needs to be like, maybe we need to seek therapy. Because there's no amount of augmenting your face that's going to make you satisfied with it, or augmenting your body.
Yeah, that's sad. I mean, it's sad, but...
So I would say come see me for a consult. We may not vibe. You might have to find another injector that you vibe with, and that's all it is.
That's all it is.
Right?
Yeah.
And that's fine.
Yeah.
It's kind of like how no practitioner is the same. You're not
Right.
necessarily gonna vibe with Emily. Maybe she's not your go-to skin girl.
Yeah, exactly.
It's the same thing. It's like your doctors. It's like your therapist. It's like everyone.
It's like everyone.
It's like everything you do in your life, you have to find what's right for you.
Yeah.
You have to find the right practitioner for you.
Yeah. That's such a good way of ending this.
Yeah.
Yeah. Last thing, and it slipped my mind, and it was a good one. Shit. That's what happens when we just talk and talk and talk. Like, I have my notes, but sometimes things come up and I'm like, oh, I should ask this, and then it goes.
Yeah.
But no, I think we covered everything. Anything I didn't mention that you want to say that I didn't ask? I think we went over pretty much.
We went pretty much over everything. And then if anyone wants to see me, I go over it thoroughly when I actually have like my notes in front of me.
Exactly. No, that's true. Areas that you don't treat, because I know, like, for example, like sweat glands, that you need to go see like a doctor to do it.
I can actually do hyperhidrosis
Can.
treatment.
Oh, I didn't know. Okay.
I do hyperhidrosis treatment for the underarm.
The underarm, yes.
However, it is quite pricey because you're needing quite a bit. So I always recommend people get maybe a hyperhidrosis diagnosis from their physicians first. And sometimes you can get OHIP coverage for that.
Oh, there you go.
Yes.
Okay.
And so I would love to, but my thing is like, hey, maybe you can get medical Botox for these areas, and then you're saving a little bit of money.
True. Yeah.
You can also get hyperhidrosis treatments for your hands and your feet. I recommend that you go to the Toronto Sweat Clinic for that, though, because they're a little bit more uncomfortable treatment areas.
Yeah.
I think a lot of people are starting to get like trapezius treatments.
That's what you're saying, yeah.
I personally only do cosmetic injections.
Right.
So I do not treat TMJ. I do not treat headaches. But my thing is I truly believe in people getting proper medical workups, because if you're getting headaches all the time, how do you know you don't have, like, I know it's kind of dark, but like you don't have a tumor?
True. No, that's true.
Like, you need to get proper workup and make sure everything's all clear before you start getting these injections that are just a band-aid for something that could be more like deeper and darker and scarier.
Yeah, that's true.
Obviously, if you get that all signed off or you get a TMJ diagnosis, you can get medical coverage for TMJ as well, right? And I only do cosmetics. So finding the right injector who actually does medical treatment.
Would you ever do that, like with your
TMJ?
with your
probably.
Practitioner? Can you do that with your practitioner?
I'm not sure.
Degree?
I wonder if you can do it as a nurse practitioner. I would love to.
Because it's a whole other
it's a whole other thing. Like, you're doing medical treatment, right?
Yeah.
But that's the thing. Like, always get workups, especially for any like headache stuff.
Yeah.
Always get neurological workups or like scans first before you start treating those headaches with injectables.
Because, like you said, it could be a band-aid for something else.
Exactly.
Yeah.
But again, I feel like that's the professional responsibility of your physician.
Yeah.
But it's also good to be aware of that
as
well.
Yes. Okay, that's good.
Yeah, so I don't do medical treatment. I only do cosmetic treatment.
Okay, yes.
Yeah.
And I know, like, the nose one.
Rhinoplasties I can do.
Yeah.
The liquid rhinoplasties.
Oh, wow.
Yes. Those are high-risk areas.
They're high risk, yeah.
Yes, high risk, because the vascular occlusions that we talked about with hyaluronic acid.
Yeah.
You can also get blindness.
Oh, my God.
Because you're occluding,
Yeah,
you can
that's
get
true.
blindness. There's like a little tiny like opening here that has like nerves, arteries, like all the vessels that just come out, and it's really close.
Oh, God.
It's like literally right in line with your pupil. It's like right here.
Oh, God.
And so when you're doing like medial face injections, you have to be really careful.
Yeah.
Because you do augment your medial face as well, just fine. But it's all landmarking and all anatomy.
Experience.
Experience. Nose is really high risk for fillers.
Glabellas, too.
Glabellas and foreheads are high risk.
Okay. For fillers.
For fillers.
Right.
For fillers. Just because it can cause blindness.
I feel like there's more high risk with fillers. Am I wrong? Okay.
You're not wrong.
Okay.
It is more high risk. That's why when people are like, what if they're thinking? I'm like, neuromodulators. I recommend neuromodulators for anyone who wants any wrinkle prevention.
Yeah. But it's true, though. Like, it's, if you're honest, you say it, you say it how it is.
Yeah. Whereas HA, like hyaluronic acid, there's a little bit more high risk because it's a viscous substance that's changing your face and adding it to the spaces of your tissues to create a different look.
Yeah. So high risk than your modulators.
See,
that's for
I
sure.
missed that part. I don't have my notes in front of me, and that's why I'm like, if you ever need a consult, you come see me, and I can actually go through all of the things.
The details, yeah.
Because I actually like check each box as I go through them before we sign the consent and all of that stuff.
And she's very, very detailed in her consults. Like, even with me, when I come back and do the talks, she's like, okay, I'm just gonna go over the consent, and I'm like, you don't have to, because like I know. She's like, no, but like no. I'm just
always.
like,
The first one is always, is there any changes in your health, and are you pregnant or breastfeeding?
Exactly. Yes, because yes, you cannot get injectable services if you are pregnant or breastfeeding. Yes, exactly.
Yeah.
People should know that too.
Yeah.
Perfect. Okay, I think we covered like a lot of information.
If people have questions, just write them down.
That's what I was gonna say. Yes, Annie can come back. We can even do like something further than injectables with her. She's awesome. If you guys want a consultation with her, just book through our links or send us an email, hello@themetaestetique.com, or you can send a DM on Instagram @metaestetique, and we'll welcome you in our place, and Annie will give you all the information you need for your specific needs. So until we see you next time, have a great night, and talk to you soon. Bye.